Great. You might be surprised to hear that. When I haven't said in public until now that I've been diagnosed with Parkinson's disease.
Well-known actor Alan Alda revealing on CBS this morning that he's been battling Parkinson's disease for more than 3 years. Alda may be best known for playing Hawkeye Pierce on the long-running TV show MASH. He said that he wanted to share his story before someone saw him shaking and wrote a sad story about it. Alda, of course, is staying very positive, posting on Twitter, I was diagnosed 3.5 years ago, but my life is full. I give talks on my podcast, which I love, and I have the diagnosis, and I just keep moving. Alan Alda says that he'd read an article in the New York Times about Parkinson's, was worried about that he might have it, and then confirmed it with his doctor. So what is Parkinson's and who's at risk? We've asked neurologist Dr. Rajiv Kumar of the Swedish Medical Center to join us this evening. In layman's terms, what is Parkinson's?
Well, Parkinson's disease is a slowly progressive brain degenerative disorder. There are a loss of a number of types of brain cells, but especially cells that produce a chemical called dopamine. Now, when we think about Parkinson's disease, we often think about tremor. Tremor is only one feature of Parkinson's disease, and it's present to some extent in about 80% of patients with Parkinson, but about 20% of patients never have much tremor. There are other problems that occur, such as slowness, stiffness, impaired balance, and gait difficulties. So these are all part of the typical motor symptoms of Parkinson.
Motor symptoms. Well, it's interesting that Alda announces today. Michael J. Fox actually was diagnosed in 1991. He's continued acting. He has continued being an advocate. He created the Michael J. Fox Foundation for research into Parkinson's. Is this the kind of disease, say like diabetes, that you manage rather than you cure or can actually abate?
Well, it's quite different to some extent in that diabetes isn't really a progressive degenerative disorder. So unfortunately, we do not have a cure right now. We do not have a treatment which has definitively been shown to slow the progression of Parkinson's disease. Yes, we manage it, and then we have treatments for the symptoms, but despite our symptomatic control, the disease progresses and our degree of control worsens. So over time, there is progressive disability that occurs. How much disability varies a lot from patient to patient because the disease varies a lot. Michael J. Fox has had a comparatively slow progression of disease, and he was quite young when he developed the disease. So he's had predominantly motor problems. Now, I mentioned did not mention there are also substantial non-motor problems, such as trouble with mood, trouble with memory and thinking, or dementia is very common. Trouble with control of the autonomic nervous system, such as control of the bladder and bowels. All of these things can occur in Parkinson's disease, and as the disease progresses, although motor symptoms become troublesome, non-motor symptoms at a certain point actually can become a bigger problem than the motor symptoms.
Let me interrupt very quickly and just ask you in real simple terms and real quick, is there anything in the hopper that's about to come forward in terms of treatment of this disease?
There are actually tremendous advances, and at my own center, the Rocky Mountain Movement Disorder Center, we do a great deal of research in this area. There are several new studies that we are doing, testing new medications to slow the progression, because right now I've mentioned we do not have a treatment for that. We have actually a number of new treatments and new medicines looking at improving patients who have variations in mobility. So you might remember Michael J. Fox used to be, when you see him on TV, fluctuating between being very slow and being excessively mobile, having these involuntary movements. So he's been on some of the newer treatments. And so newer treatments can really improve quality of life also. So there's a great deal of hope.
Good to know. Good to know. All right. Well, thank you very much, Dr. Rajiv Kumar, who's coming onto our set here from Swedish Hospital. We appreciate it.
Thank you very much.
Now